Happy pre-Labor Day weekend. It's a busy time, but it's so important, I think, for you all to come out and listen and interact and talk about what's important for Virginia and how we can move Virginia forward. And especially if you're involved in nonprofit organizations, thank you so much for what you do. As we say, it takes a village, doesn't it? And I think a great example of how we all come together to help others is what's going on in Texas right now. And so I'm sure, like you, have watched just the tragedy down there, the loss of lives and people's homes and pets, and just their lives have been turned upside down, literally. And so, I would ask all of you to keep those folks in your thoughts and prayers. And if there are ways that we can help, please do that. And we have sent resources. Our administration has sent equipment. We have sent, men and women that are down there now helping these individuals. So it's important for all of us to come together. And, the government obviously has its roles, and those are things like to provide transportation and education and health care and first responders. But there are so many other things that make our lives better, make our society a better place to live and raise our children, and that's where the nonprofits really come in. And so we want to continue to do everything that we can at the state level to support our nonprofits and also work collaboratively, because we're all kind of in this together at the end of the day. I want to just, if I can, tell you a little bit about my experience and also my wife's experience with public service and nonprofits. And as Karen said, Pam and I separated from the Army after 8 years. I was over in Landstuhl during Desert Storm, and we had 2 small children at the time, Wes and Aubrey, and so we came back to Norfolk, and I started my practice in pediatric neurology. There were about 30 pediatric subspecialists that formed a group called Children's Specialty Group, and I was taking care of sick children and their families and raising our children. And one day I got a call from Karen, another Karen, not the same Karen, and she said, "Have you heard of Edmark Hospice?" And I said, "Well, yes, I have. I've referred patients to Edmark Hospice, and I appreciate the work that you all do." And she said, "Well, we need a medical director." And she had actually asked my partner first, and he was at the time the dean of the medical school, and he had an overflowing plate, as a lot of folks do, and so he had given him my name. So Edmark Hospice, just so you know a little bit about the process, is that a Presbyterian church about 40 years ago now, there were 2 members of the church. One was Ed. He was actually an adult who had terminal cancer. And then Mark had a terminal a neurodegenerative disease. He was a child. But anyway, these families chose to keep their children at home and the adult in their last days of their lives. And there was really nobody to take care of them. And so Edmark Hospice was started. And it's the only pediatric hospice in Virginia. So anyway, I went to the first meeting, and the census was 18 terminally ill children, and we went through the list, and most of them had cancer, some of them had genetic disorders, and anyway, at the end of the meeting, I said to Karen, I really appreciate you inviting me to be your medical director, but I said, this is too sad. I can't do this. And she said, well, Ralph, we really need a medical director, and maybe you come back next month and we'll keep working through this together, which I did. And so the rest is history. And so for 19 years, I have done that as a volunteer. Our census, believe it or not, now is around 70 terminally ill children. And I can tell you, people often say, you know, how do you deal with politics and, the rough and tumble? And I will tell you that I haven't experienced it, thankfully, but I don't think there's anything more difficult than the loss of a child. I have seen what that does to families, the financial issues, just the relationships, siblings, etc. And so for these individuals to put their trust in my life, or in their life at this time of their just terrible tragedy, has really helped put things in perspective for me. So that's what the importance of public service is. That's what the importance of nonprofits are, which Edmark is a nonprofit. And I encourage you, if you ever get a chance, go to the website and take a look. But just do wonderful work. Now, my wife, as Karen said, is an educator by trade. She's from San Antonio, Texas, and a couple of years ago, she's has very strong feelings about the environment. And so a couple of years ago, she started working for Lynnhaven River Now. And that's also a nonprofit in Virginia Beach. And she does the faith-based education outreach. So she goes into churches and synagogues and temples and mosques and really talks about how important it is for all of us to be stewards of the environment. And what a great concept that is, a great way to get to people and communicate and share ideas on how we are all in this together and how we can make things better for all of us. And in this case, their work mainly is to clean and restore the health of the Chesapeake Bay. And they work side by side with Chesapeake Bay Foundation there in Virginia Beach. So if you ever get a chance to look up Lynnhaven River Now, they're actually in the Brock Environmental Center, B-R-O-C-K. It's one of the greenest buildings. So it kind of shows what we can do if we put our minds to it. They have solar, they have wind, don't use any electricity from off their premises, take care of all their water, sewer needs, everything. So the Brock Environmental Center, Lynnhaven River Now, again, another wonderful example of how nonprofits contribute so much to our community. So what do we do at the state level? Just a couple quick items, and we'll open it up to questions if that's okay. If you need to give me the hook, that's fine as well. We've brought in a little bit over 200,000 jobs to the Commonwealth of Virginia. Our unemployment rate has gone from 5.4 to 3.7%. It's the lowest that it's been in Virginia in the last 9 years. So good things are happening. We still have a lot of challenges. And one of the things that the Governor McAuliffe, has allowed me to do, said, Ralph, you can do anything you want as Lieutenant Governor as long as it contributes to economic development. So we formed the Children's Cabinet. We had never had a Children's Cabinet in an administration. And so I sit on the Children's Cabinet, and three areas that we're focused on. The first is home visits. And there are a lot of at-risk, especially single mothers, who may have 1, 2, or 3 children. And so we have really tried to get into the homes and encourage the mothers to continue with their education and try to get back into the workforce, and to make sure the children are ready for school, that their immunizations are up to date, that their nutrition is good, those types of things. And unfortunately, for every one house that or home that we can get to, there are 10 that we can't. So we still need resources and people, and this is again where nonprofits come in. The second area is child care. And we know that that most households now, both parents are working, so it's very important for them to have access for their children to affordable and quality child care. And that's just peace of mind. And that's their pride and joy, and we really want those children to be in child care where it's safe and economically feasible. So we've spent a lot of time, and again, nonprofits are a big part of that process. And then the third area that we've really made a lot of progress, and something that I feel very strongly about, and that's early childhood education, i.e. pre-K. And so we applied for a federal grant. We were awarded the grant. It was $70 million over 4 years, and we have used that to kind of jumpstart pre-K education. And so you ask, why is that important? Because it's important, I would tell you, as a parent and also as a child neurologist, there's a tremendous learning potential in our children before they ever get to kindergarten. And as you know, our children are learning to read up until the 3rd grade, and then after that they're reading to learning. And if our children aren't reading by the 3rd grade, they're at a disadvantage and they'll never catch up. So we just this past year opened up 13,000 more slots to pre-K. And I make the point to folks, if one family has the means to send their children to pre-K and another one doesn't, that's really what starts the gap between the haves and the have-nots. And you can either invest in it responsibly at an early age or try to catch up at an older age and math is very simple. And so I will leave you on this, and I've talked to a couple individuals that are working with literacy, and it just is so important. I'll leave you on this note, or not leave you, but I'll turn it back over to Karen. They tried to teach me Spanish in high school. Okay? If you came up here, Karen, and tried to carry on a conversation with me in Spanish, we wouldn't get too far. Now, I can do a little bit, and when patients come in, I can listen and figure out most of the time what they're saying. But the point I'm going to make is that the time to teach a second language is before they ever get to kindergarten. That's when the synapses in the brain are forming. And if children are exposed not only to their primary language, but a second language, when they're 2, 3, 4 years old, the brain develops in, and then they can even learn other languages, third and fourth languages as they get older. So I'm a big advocate for early childhood education. And if anybody were ever to ask me, said, Ralph, what do you want to do as governor? It's really to give children the same opportunity that I've had, and to make sure that they can live the American dream. So that's why I get up every day. I'm an advocate. I love children, and I'll do everything I can to make sure that they have the same opportunities that I've had. So thank you for that. I have a lot of businesses and a lot of nonprofits that are under the tent, if you will, and that want to contribute to the development of pre-K education in Virginia. And I think a couple things that are important. One, it has to be transparent. So we have to make sure that the education that we're delivering to our children is open. It also has to be reliable and of high quality. And so we have a test now that we've actually worked with the University of Virginia on looking at readiness when these children that we expose to pre-K are ready for kindergarten. How are they doing, and is this really working? And the answer to that is it is, but we obviously need accountability. So there are nonprofits, there are faith-based groups that are interested. There's the public school system, private schools. We're all in this together. So the trick, if you will, is to bring all these groups together. You've heard the same before. We have a lot of different silos, and this is an area that we do have a lot of silos, and we need to bring those silos together. We have funding for it, so this is one of my projects, and I wish my wife were here because she's a K through 5 educator. So we're going to all work on this together and make sure that at the end of the day that all of our children have access to pre-K.
Fantastic.
And I like to go around and talk to the schools and listen to our children. And I was in a 3rd grade classroom, and Matthew, I kind of talked about democracy and that I work for the people, and what would you like me to do when I go to Richmond? This was as a senator, and he said, do you know what texting is? And I said, I do, but I'm not very good at it. He said, well, I don't think it's safe when people texting and drive at the same time. So anyway, that's I didn't introduce that, but that's now against the law in Virginia. But the other thing that he said that every time I get in a car, I put on my seatbelt, and this is a 3rd grader, by the way, and he said, and this is nothing against mothers, but he said, my mother lights up a cigarette, and I have told her that it makes my eyes water and stuffy nose, etc., and to please not smoke, but she won't listen. And he said, can you go to Richmond and introduce a law that says you can't smoke in a vehicle when there's a child in there? And I said, man, that's a good idea. If you think about asthma and otitis media and bronchitis and even SID, sudden infant death syndrome, it's the incidence higher if children or babies are exposed to smoke. So anyway, I went up to Richmond and I called it Matthew's Law. Well, it passed in the Senate, and then it got down to the House, and as we say, caught a little bit of a fever, but they said it was too much government. They said, Ralph, last year you told us we can't smoke in restaurants. This year you want to tell us we can't smoke in the car. What's it going to be next year? You can't smoke in our own house? I said, maybe. But anyway, that has now become law in Virginia. So this is the way we can kind of... And then the last thing, as far as what we did from the Foundation for Healthy Use is with childhood obesity. I introduced a law that said that all children must have at least 150 minutes of physical education each week. And I tell people, and I told them when I was introducing the law, if someone had asked me what my 3 favorite classes were in school, it was PE, recess, and lunch. And somehow I made it through. But anyway, that has now become law in Virginia as well. So this is how the state legislature can work with the private sector and nonprofits to make Virginia better for everybody. So, and just as she said, there's a very viable pipeline from school to prison that we should not be proud of in Virginia. We should change that from a school to prison pipeline to a school to workforce pipeline. And so there are a lot of things that we have done in Virginia. We've put a lot of emphasis on juvenile justice reform, making sure that rather than putting teenagers that make a mistake, rather than putting them into a detention center, we want to keep them in communities. We want them to have mentors and counselors. So that has worked well. Let me just talk about something else that I think is very, very important, and I'm going to come full circle here, and I'll try not to be too long-winded, but we spend over $67 million in Virginia each year on enforcing marijuana laws, and we are arresting individuals and putting them into our jails and penitentiaries, and just as Karen said, they get into a vicious cycle and they never come out, and we're literally ruining people's lives. And I will tell you, there's a tremendous inequity in who gets arrested. If an African American is standing next to a Caucasian and they're both smoking a marijuana joint, if you will, guess who gets arrested? 3 times more likely. And so that's something that we need to talk about, and that is the inequity of justice reform out there. And so there are other things that the criminal larceny, felony larceny is right now at 200. So if I were to take one of your cell phones on the way out, I could end up being charged with a felony. That needs to be raised to at least 500. Some people would say 1,000. And then the last thing I would say about the marijuana is we really need to look at decriminalizing that. And what that would do is it would really tie into potential medicinal uses. There are over 100 medicines that we use right now that come from plants, and there are potential uses for marijuana, such as post-traumatic stress disorder, chronic pain. We have a tremendous challenge with opioid crisis here in Virginia. So we need to change the classification of marijuana so that we can then do research and collect data and then have it available for medicinal uses. So anyway, that's a long-winded answer, but there are a lot of things that we need to do to interrupt that pipeline. And then finally, something else that I think is so important is early childhood education. Trying to prevent our children from ever getting into that pipeline and making sure that they have access to good education, that they have access to good, healthy lifestyle, decision making. All of these things are important. And as you know, our children are very, very impressionable before they get to kindergarten. So it's not only the didactics, that's not the only importance of pre-K education, it's teaching them good life habits as well. So all of these things are important for interrupting that pipeline that we currently are dealing with. Very hard. And the answer to your question, what will we do? I'm going to have someone in my administration, and that's all they're going to concentrate on, is how do we help individuals with disabilities? How do we help them with education? How do we help them enter the workforce? Because they, again, how do we help them with transportation? All these things are so important. And I've always told the legislators, I said, you know what? You all should get up in the morning and just get in a wheelchair and make your way through the day. And then you would understand a little bit better what people with disabilities, and there are obviously a lot of different types of disabilities, but we need to make sure that they have a voice, and I will do everything that I can to give them that voice. Karen asked about FAMOUS. That's the form of Medicaid that we use for our children. And as you all saw, just like I did, for 7.5 years, people in Washington have been telling us that they want to repeal and replace the Affordable Care Act. And now the plan that they have put on the table will put up to 32 million Americans, especially those with pre-existing conditions, at risk of losing their coverage. That's just unacceptable. And a lot of those individuals will be our children. So I guess just in a broad sense, I will tell you as a doctor, there are some very good things about the Affordable Care Act. Things like no more pre-existing conditions, things like being able to keep our children on our policies till they're 26. Pam and I did that with our children. The emphasis on access to mental health care, access to women's reproductive health care, access to preventive care, all of these things are good. So let's not just say we're going to repeal and not have any viable option. Let's bring people to the table, number one, that understand health care and get the politics out of it and do for a change what's in the best interest of this country and specifically what's in the best interest of Virginia. And so I want to just make a point. I don't think that they're going to repeal the Affordable Care Act, at least anytime soon, because they have figured out, even as our president said, he's agreed that it's complicated. So that's the first step. But if they don't repeal the Affordable Care Act, we need to bring people to the table and expand Medicaid in Virginia. For 3.5 years, we have allowed 400,000 working Virginians not to have access to coverage. That's immoral. And also from a business perspective, every day that we don't expand Medicaid, and this is tax money that we have sent to Washington, all we're asking for is to bring that money back to Virginia. But every day that we don't, we're not only leaving on the table, but we're giving to surrounding states over $6 million a day. Since January of 14, we've given over $10 billion with a B dollars to other states who we compete with. And so I tell people, and you may have heard me say this before, but as a business person, if you tell me that it's a good idea to give your competitors over $6 million a day, I'm going to tell you as a neurologist, you ought to have your heads examined. So that's where we are. But to your point, the counties really need, jurisdiction to be able to have taxing authority, that type of thing, compared to the cities. And so there's becoming an increase in imbalance between, for example, cities and counties. So it's something that needs to be addressed, and it can be part of what we've talked about to have a comprehensive tax reform plan in Virginia. We need a tax code in Virginia that is simpler and fair and that's fiscally responsible, one that doesn't threaten our AAA bond rating, one that doesn't take resources away from investing in things like education and transportation and healthcare. So the Dillon rule can be tied into that discussion, and that's something that I plan to do as soon as I get elected in November. So it's something we'll be working on. Teachers, we need to pay them a fair salary. So that's one thing. And then the other thing regarding building of schools, I would ask questions to everybody that wants to be an elected official. When you talk about things like vouchers and private schools, we have to be very careful not to take any of the funding that we have away from K through 12 education. And so some of those plans out there too. So we need to make public education whole before we talk about private schools and vouchers and those types of things. And obviously there are good options, and I take care of a lot of children that are homeschooled, and that's great, but let's work together and make sure that we fund K through 12 public education, and then we can talk about some of these other issues as well. So thank you. Because politically, legislators have chosen not to expand Medicaid, and also because of what we call managed care Medicaid rather than straight Medicaid, Virginia has been very frugal with Medicaid spending. So we're 47th in the country right now. So again, we're watching very closely. These policies that are coming out of Washington could just really adversely affect what's going on in Virginia. And to your point, if they go with a block grant and cut Medicaid spending, we're very, very vulnerable in Virginia. So it's going to be very important to have someone at the table that understands health care and understands the importance of taking care of individuals with disabilities. And so the last thing I would say about that is I'm very familiar with Medicaid waivers because a lot of my patients have applied. We have over 10,000 individuals right now in Virginia that are waiting.
That are waiting, yes.
That's unacceptable. So yes, the long-winded answer to your question, I will be there and do everything that I can to help with the Medicaid waivers and to make sure that we're taking care of individuals across the Commonwealth that rely on Medicaid.
Thank you.
Yes, and thank you so much for your question. I'm sorry for your loss, and I'm so glad that you're trying to make good out of a tragedy in your life. And this is something that we all need to wrap our arms around, She just made the point that the highest number of deaths is coming from opioid overdose. We have lost over 1,000 Virginians this past year to opioid overdose. That's more than will die from motor vehicle accidents. So it's something that we are very aware of. And I think to your point that it doesn't discriminate, does it? And you know, it may be in our family or a neighbor or a relative. And I have heard people in politics sometimes, and these are not good people. Well, they are good people. It's just that they have gotten on a path that has gotten them into being addicted. And a lot of that, by the way, starts with people like me who prescribe opioid medications. And so we have worked very hard, and I have traveled around the Commonwealth to work with our medical schools and to teach our residents and students that there are different ways of dealing with both chronic and acute pain. We work with law enforcement. There are far too many individuals that are addicted that are in our jails and penitentiaries. We have put more money into our mental health program in Virginia. We just put $30 million more this past year to help with opioid addiction. But to your point, we need to. We're not getting where we need to go, obviously, and it's important for us to collaborate with groups like yours. And so I would be more than happy, willing to sit down with you and talk about how we can work better together, how we can help fund some of these things, because as you know, the community service boards are busy, and people that need help can't always get into have the help that they need. The last thing I would say, other than just want to work with you, is that we wrote a blanket prescription for naloxone. Naloxone is the medication that will reverse the deadly side effects of opioids, and so now if anybody knows a family or a friend or whatever that's at risk for opioid addiction or overdose, they can go into a pharmacy without any questions asked and request a dose of Narcan, which is the naloxone. And if these individuals are exposed to opioids, especially heroin, and don't have that to reverse the side effects, then they're going to become a statistic. And just as she said, that it starts with prescriptions, and then people can't get a refill sometime for their prescription, so they turn to heroin. And now heroin is being laced with fentanyl, and then carfentanyl, which is 100 times more potent than fentanyl. And so we've really got a problem on our hands, and it's going to take all of us working together. The government or Richmond can't conquer this by themselves. And I'm so glad that you're helping out, and look forward to, again, looking at ways that we can work together to address that issue.
Thank you. I'd love to work with you. Yes. And also on the Narcan point, if anybody is unable to afford getting it from the pharmacy, we do provide that to people free of charge as a foundation. So.
Thank you so much. If someone has alcohol in their system, alcohol is metabolized by the liver, and it's gone after a day or so. Marijuana stays in for weeks, and so how do you test individuals? And I would hope, and I'm not smart enough to sit here and tell you that I have an answer for, but I would hope with technology that we're able to come up with some tests that would be able to deal with that and be more accurate. But here's the bottom line. We need people like you at the table when we talk about decriminalizing marijuana and look at all of the different sides. And again, it's not something that I can do by myself, so it's going to take people working together. And just one case in point, I take care of a lot of children with intractable epilepsy or seizures. They have been helped so much by what's called cannabidiol oil, which comes from marijuana, but it was so difficult to even get the legislature to approve of that. So there are potential medicinal uses out there that I think we have to be open-minded, but certainly have thorough discussions before we go off and make policy. So thanks for all the work you do, and appreciate the question. Thank you. Yes, sir. Some excellent points, and I think a couple points very quickly is that, as we said, there's still a lot of silos out there. We need to organize these and collaborate with each other, and that's why I will have someone in my administration that will specifically deal with that issue and make sure that individuals with disabilities have a voice. The last thing I will tell you, and I think if you look around this room and look at our society, we live in a very diverse society. That means that we need to be inclusive in Virginia, but my cabinet and my administration will look like our society. It will look like this room, and I think that's very important. We'll have people that understand the challenges that we have. I want them at the table. I want you at the table. I want you involved, and that's the way we're going to move forward together. So, Karen, I thank you so much for having me here today. You've done a great job.
Well, it's been a pleasure having you. How about you?